Hi, I'm Joe Spina, and welcome to the Joe Show, where truth is our mission, rally our realm, said as we see it, and frankly as well. Forrest Gump famously said, "Stupid is as stupid does." Sales of plexiglass tripled to roughly 750 million in the US after the pandemic hit. Offices, schools, restaurants, retail stores, they all sought protection from droplets that the health authorities suspected were spreading the coronavirus. With just one problem, one little hitch. Not a single study has shown that the clear plastic barriers actually stop the spread of the virus, said Joseph Allen of Harvard's Chan School of Public Health. Study after study that they conducted. Very little money was, actually the money and the time that was spent focused on what he called the hygiene theater, whatever that may mean. And he said when the real threat was airborne transmission, the real threat of the coronavirus was airborne transmission. For months and months and months, the COVID-19 pandemic, pandemic, top health officials pointed to larger droplets as the key to transmission. Those were the bad guys. Those were the culprits, large droplets. That's how the coronavirus was transmitted. Well, the truth of the matter was that a whole bunch of researchers were protesting and saying, no, that's not the case. Allen was among them, as were other researchers. And we're not talking about, Mickey Mouse schools. We're talking about the Harvard Klan School of Public Health. They said thinner, smaller droplets also can spread the virus, they warned. Now, forget about these large ones. The little guys can do it just as well. They can spread it, and that's a different atmospheric. Translated, what that all meant was the plastic shields can't stop its transmission and therefore is useless. Similarly, masks. Now, study after study after study, including the American Institute of Physics, said categorically that masks were useless. They did exhaustive studies. And the reason is quite simple. And here's the analogy, see if you can figure this one out, is that everything is a weave. So think of how about a tennis net? Well, a tennis ball doesn't go through the tennis net because the ball is bigger than the gap in the tennis net. But if you have a tinier, smaller droplet, so to speak, or a golf ball, for example, it's going through the net as if the net wasn't even there. And that's precisely what researchers like Allen, and they're environmental, by the way, environmental engineers, ventilation specialists and things of that nature. That's exactly what they're arguing. They're simply saying that the shield, these plastic shields, do not protect against smaller particles that are airborne, that stay in the air and are circulating around. And if the end of the ball game is if other people in the room are infected and they're exhaling these small droplets into the atmosphere and spreads around, everybody gets it. And the plastic masks of the plexiglass is of no value. And it wasn't until last month, mind you, that the World Health Organization and the CDC affirmed that airborne transmissions, as opposed to droplets, this ventilation is the problem. which is why being outside is so healthy, because it dissipates. When you're in a contained area, it doesn't dissipate. That's the problem. Plastic shielding effectively, like a mask, created a false sense of security. Now, one of the things that drives me absolutely bananas is when I see someone with a car driving with a mask on all by themselves with the windows up, protecting against who knows what. But it's a false sense of security that people have. People are risk adverse. And if anything that makes them feel, whether it's real or imaginary, safe, I guess that's what it's all about. So, a building scientist, otherwise known as Mara Zatari, and who's a member, by the way, of the pandemic task force of the American Society of Heating, Refrigeration, and Air Conditioning Engineers, because the issue becomes ventilation. Talking about the sense of security that people get with the plastic plexiglass and masks. So especially when you use it in an office or school, specifically plexiglass does not help. That's what he's saying. It does not help. If you have plexiglass, you're still breathing the same shared air of another person in the room. That's simple. Recent CDC research found that desk and table barriers in schools, they didn't correlate with lower infection rates. Ventilation did, or ventilation improvements did. An April study was conducted by journal Science. Got that? Science, follow the science. Suggested that desk shields might even, get this one, raise the risk of COVID-like symptoms rather than reduce them. And a pre-publication of a paper from Japan last month in May linked plastic shielding with infections in a poorly ventilated office. They did a comparative. Thus, their conclusion, too much plastic impedes ventilation. In effect, that actually raises the risk of covert transmission that they intended to reduce. That's the science. Why the NIH or the CDC or the WHO rather, World Health Organization, and Dr. Fauci himself, why haven't they followed the science when it comes to plexiglass? Furthermore, why is plastic here, there, and everywhere if that's the case? Could it be that Forrest Gump said it best, stupid is as stupid does?